Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
G'day and Swadee Carb. Well, today we were blessed with two fantastic talks that dealt with what happens to your joints as they age and what you can do about it, especially focusing on the hips and the knees. And we were really blessed. By the way, you've got to watch these talks. They're fantastic. Dr Nammon, you gave a really great overview of the whole hips and knees issue. And of course, this is a big issue as people are getting, more people are getting older.
Right, it's like the frequently happen in the the patient who has like the hip and knee. Yeah, right.
Do they often go at the same time, the hips and knees, or mainly separately?
Separate.
Yeah. So, what sort of symptoms can people expect if if they're starting to have a hip problem?
Yeah, for the hip problem, the patient has come with the groin pain, hip pain, thigh pain, and not below to the knee, right? Not below to the knee. This is a typical pain from the hip joint.
Can you contrast that with like sciatica pain? Yeah, what's the difference with that? Because that's from your lower back, really, your sciatica.
Right. For the sciatica pain that I told you, right, is should have like the pain down below the knee. This is like the typical pain from the sciatica and related to the distance that you walk, right? Yep, if you walk for quite some distance and you have pain and like the shooting pain down, numbness, tingling feeling, this is the sciatica pain. But for the hip pain, the pain has should like the loading pain, all right? It's related to the position, to the joint loading, and not longer down to the leg.
So a sciatica pain tends to be more at night, is that right? And the other hip pains are more general through the day?
I think that for the sciatica pain is more general than the hip pain.
All right.
Yeah, right.
So what time of day do you expect that people will register hip pains?
For the hip pain, I think because of we are in Pattaya, in Bangkok Pattaya, we deal with the foreigners, all right? For the hip disease, it rarely to happen with the Asian people or Thai people.
Wow,
yeah, right. It depends on the race as well, right? Yeah, but for the Europeans, something like that, it's like the abnormal that I discussed in the lecture, right? It's like the abnormal of the anatomy, right? So it can create about the problem of the hip more than the Thai people or Asian people. So when we practice in Pattaya Hospital, in Bangkok Pattaya Hospital, so we found the hip disease case is like they quite frequently.
And do you think that's to do with weight? Because a lot of Europeans are carrying much more weight than Thais.
For the weight as well, but it's like the multifactorial, right? Yeah, for the abnormal of the anatomy is like the most important thing that you will see in the X-ray in the foreigner or European. It's like there's like a bump or something at the femur, right? So it's like the impingement. It starts from the the unproper joint proportion, and it create about the next degree of the degeneration.
So this was a fantastic talk. It was really, really educational. There was nobody in the audience, we did have one doctor in the audience, but who didn't learn something. Even the doctor commented on how wonderful this talk was. So what can you do if you just suspect or you want to prevent yourself having hip issues? Is there some exercises you can do?
The muscle exercise, strengthening exercise, the activity like the proper for you. This is like the efficiency of the to delay about the the hip disease, right? So I think that keep active in my concept. The keep active and exercise to the keep your muscle strengthening. This is like the good thing and best thing that you should do.
So there is a very, very good takeaway. What about supplements? Because I hear about collagen a bit. People talking about collagen. Is that relevant to the hip joint?
You can try to take the option of the treatment like the vitamin, glucosamine, something like that, all right? But that I told, all right, in the lecture or give talk, it is like when you turn to the mechanical problem already. I think that for the medication, for the vitamin, it's just like the limitation by itself. So if you have like the migraine of that, of the symptoms, you can try everything, all right? don't have something like the contraindication or something like that.
So there you go. Some of the basic fundamentals, like keep your weight under control, do weights, keep strong, keep mobile.
Yep, right. Keep mobile, keep exercise, strengthening exercise. Yep.
Right. So there you go. And one of the things you can do is you can educate yourself, and you can educate yourself about hip and knee issues, and you won't find a better summary of them and the treatments for them than in this talk. I guarantee you'll learn something and you'll help yourself by becoming educated. So thank you so much, Dr. Nammon.
My pleasure.
Yeah, thank you.
Okay, yep.